Conway Medical Center and WPDE News Channel 15 present Your Health, Your Decision.
People with diabetes are more prone to foot problems because of a couple of reasons. First of all, the long-term damage of high blood sugar hurts the nerves in the feet, and it also hurts the blood vessels in the feet. So when your nerves don't work well, that means you can't feel things. So normally if you have good sensation in your toes, if you step on something sharp, you'll feel it. If your shoe is rubbing against your foot, you'll feel it. But in diabetics, these things don't happen. So they develop blisters, they come in contact with things that cause tears in their skin, and they don't even know it. The other problem is with the blood vessels. The blood vessels tend not to work as well. They get little clogs, they respond differently to the feet and to pressure. And so you don't tend to get as good healing when you do get a wound, because the blood to the wound is necessary for good healing. Well, summer months pose more of a problem because people living in a beach community, they don't like to wear their shoes, they like to wear flip-flops, they like to walk barefoot, it's hot, it's comfortable, and so that creates a problem, especially as a diabetic. In the winter months, you're wearing your shoes most of the time, you're not spending too much time on the beach, so those problems become less significant. Keep your feet protected at all times. I mean, I think if you're walking on the beach, okay, you can go barefoot, but on the other time, really try to keep shoes on or some type of protective footwear. The other thing is to make sure and look at your feet every day. A lot of times diabetics will develop wounds. If they take care of them right away, they can prevent them from worsening quickly. But if you never look there, you won't discover them, and they can get very bad very quickly without the patient even knowing about it. The other thing is shoes that fit well to your feet, and maybe specific inserts for your shoes. And that's where a podiatrist comes in. Diabetics are usually authorized to get special type of inserts for their shoes or diabetic shoes that help protect their feet. Every part of your body is important, but the feet are especially important because you bear so much weight on them. They're also our means of mobility. If you have major damage to your feet and can't get around, that has a major impact on your ability to work and your ability to have fun. So foot injuries impact significantly in our daily lives. Well, if you notice a wound, the first thing to do is to clean the area. A lot of patients want to use hydrogen peroxide. Please don't use that. That can really hurt the wound healing. But to clean it with a soap and water, and note any redness or swelling around the area. If you have redness or swelling, you should probably contact your primary care physician. If you can't contact your primary care physician or your wound is worsening, you can certainly self-refer yourself to the wound care center. When we see patients for foot wounds, obviously the first step is to try and gather some information about the wound. I usually try to do that over the phone before a patient comes in for a visit, so that we have some idea of what to expect. Then when you come here, you're assessed by the nurses. We look at the wound closely. We check the blood supply to the wound as best we can. And then we determine what course of action is best for that wound. Depending upon what other illnesses you have or how significant the wound is, we have a wide range of treatments, as simple as a dressing or as in-depth as hyperbaric oxygen therapy. When we have diabetics who have deep wounds, especially if they have bone infections, hyperbaric oxygen therapy is a great asset to have in treating those wounds.
For more information, visit us online at conwaymedicalcenter.com.